Well, welcome to the HIMSS Washington Virtual Summit. We've been having sessions from 1 o'clock to 2 o'clock starting on Tuesday. This is our final session for this week. We'll have 3 more sessions next week. And I'm very excited about today's conversation. We're going to be talking about remote work pre and post COVID. We have 2 speakers, Robert Pageler, Scott Waters, 2 CIOs from our local community that have been very well involved with HIMSS over the last year. And I think they've got some great information. And I'm going to turn it over to them right now.
Thanks, Dwayne. Hi, everybody. My name is Robert Pageler. I'm the CIO at Confluence Health. Been there about 6.5 years. Previously worked at Providence, at Swedish and at Swedish Edmonds, as well as Dignity Health for a stint. With me, Scott Waters from Overlake. Scott, you want to introduce yourself?
Sure. Thank you, Robert. Scott Waters. I'm the Chief Information and Technology Officer for Overlake Medical Center. Been here for about 5.5 years. And before that, I was the CIO for Carson Tahoe Health in the Carson Tahoe Valley. Happy to be here with everybody today.
Great. Okay, go ahead. Next slide for us, Dwayne. So I'll start off real quick, giving a background on Confluence Health. We are located or based out of Wenatchee, Washington. Basically, the north central Washington part of the state is what we cover. It's about 12,000 square miles with 12 clinics, 2 hospitals that are in Wenatchee. And so it's a large geographic area, but basically just think of us as being between Spokane and Seattle. And we have about 4,000 employees. Scott, you want to go ahead?
Sure. Next slide, please. Overlake. So for those of you that aren't familiar with Overlake Medical Center and clinics, if Robert handles the east side of the mountains from Spokane to that point, we kind of pick up right there at the mountain range and take it to Lake Washington. So we serve the east side up and down the 405 corridor, and we are a single medical center system, 349 bed medical center, level 3 trauma center. And we have a fairly large ambulatory network that stretches up and down that 405 corridor.
Perfect. And to start us off, this quote is just absolutely perfect for this discussion. So transformation of an enterprise begins with a sense of crisis or urgency. And obviously what we're referring to here is the COVID crisis that hit us this year. And basically, you know, the topic of remote work and how we immediately were required to provide a solution for that. Scott and I, as we prepared this conversation, we really started to realize how similar the requirements were and the way that we handled these requests. So I believe probably most of you on the phone have felt it firsthand, and I think you're going to hopefully relate to a lot of what we talk about, and this will be kind of a sanity check to make you hopefully feel better about, hey, I handle it the same way, or there's a couple things I can take away from this that maybe I can apply at work. And as well, I think Scott and I, and maybe the panel, we're all kind of looking forward to learning from each other as well. So with that, getting started, next slide, please. We basically came up with 3 things that were the requirements when COVID hit. So it was quickly moving remote for non-clinical, non-essential, so people that didn't need to be on site. That was a requirement. Also looking to move what we could of the clinical areas. And then as well, making sure that we were providing security in this and not just going willy-nilly and opening us up for a bunch of problems. So Scott, you want to start with the first one?
Yeah. And you know, the funny thing, just before I start, that kind of hit me as Robert and I were starting to kind of put this thing together was prior to the COVID emergency, the pandemic, we were looking at remote work as a nice to have, kind of a staff satisfier, a recruitment tool, something like that. And so we had some things in the works, but there was not a lot of urgency behind it. And obviously, you know, a good crisis will get you that urgency. So, so the first thing was, how do we get folks that don't have to be on campus to provide patient care in the middle of this crisis? How do we get them off-site, keep them kind of spaced out and as safe as possible, and still maintain the functions and the support of the organization? And from my perspective, I made the call to send all the IT staff home, day one, 100% sent them all home. And my thought process at the beginning was not that, it was really focused on, we didn't know what we didn't know in the middle of the pandemic. We didn't know how bad it was going to be. We didn't know who was going to get sick and how sick they were going to get. And so I was operating under the assumption that all of our team would eventually get COVID. And I wanted to make sure that we spread that infection rate out so that the health system could kind of maintain, and that as an IT team, we were able to maintain our support of the health system. So we don't want everyone going out sick at the same time. If we're all working in the same office, that's what happens, right? So that was job one, get people off campus so we can maintain the support for the organization so that the caregivers could be supported, right? So that was individual staff functions. So on a case per case, moving people off site and giving them what they need. And the more challenging things were moving whole departments. HR workflows were particularly difficult. We had to move our whole HR department off site 100%. And it was shocking. You'd think with all the changes in technology and all this great stuff that we're working with that problems like printing and faxing wouldn't really become an issue, but they did. And so we had to address those quickly.
And at Confluence, very similar to what Scott experienced as far as the request for the non-clinical facing departments to move off-site. One of the things we were lucky with is, as part of our employee satisfaction, at least in the IT area and different departments somewhat related to IT, we had tried to move a lot of it off-site already to remote work. So we were about 50% remote. And that helped as far as driving the tools we were using, as far as just they were baked in, but then at the same time, we also kind of had a little bit of experience on it, but still was tough with the flood that came in of requests from different departments. But I think what we did that was successful was we would sit with the departments, assess them before they were given the blessing for the most part, and set technology expectations. And that was difficult because they were not able to do necessarily 100% of their functions from home. So they had to plan on some hybrid of maybe coming in for certain things, but for the most part working remotely. So the next piece of this was the clinical side, and I'll start there and then hand it back to Scott. But basically on the clinical side, because the patients are now afraid to come in and be exposed to other patients, and obviously the elective surgeries were stopped eventually, et cetera, we did end up really leaning on the telehealth solutions that we were using for virtual visits. And that was a rapid deployment on top of the remote requests for departments. So it ended up being just kind of a very quick, what was probably a 6-month project done in around 5 days, resulting in what used to be virtual visits of about 15 a day to several hundred. Maybe I think we pushed as high as 480 in a day within 10 days of rolling it out. Scott, I think you had something similar.
Yeah, it was very similar. And I think we were in almost the exact same spot, right? We were doing some telehealth, a lot of phone visits. We hadn't deployed video visits and things like that. And the volumes were very low. And then within a matter of 5 to 10 business days, we had to, kind of roll out video visits. And it was rapid deployment at its best.
All right. And then finally, under security, when Scott and I were talking through this, obviously you can't just throw everything out there and say, well, let it be a free for all, even though it kind of felt like it. At Confluence, we had one solution that we offered for everybody, and that was VDI with multi-factor authentication. So we were in good shape as far as we didn't have any other methods to kind of lock down and figure out how we were going to support them. But we did struggle with tracking physical assets. We did not really have a mechanism for that because people were taking things home. We just decided not to worry about it too much and catch up later. And we did lean on folks to possibly use BYOD if at all possible, because they could just come in simply to the VDI through the web, and basically very quickly got up and running versus us trying to configure and make sure the equipment worked at their home. And once again outline the technology limitations, such as no printing from home and any areas like call centers where we had phones that were doing call distribution. Those were limited. They're still limited today. We actually just make the physical space bigger. We have not delivered that to home yet. And Scott, I don't know, similar again?
Yeah, very similar. It was shocking to me how people handled the everybody head for the hills, run, go home and work. They literally were picking up equipment and taking it with them, and it was a bit of a free for all, to be totally honest. In those first days, we adapted and got the inventory under control, but that was very difficult. Those first few days, people grabbing monitors and then all the support calls that would come in as a result of not being able to set up this equipment at their house, and it created a lot of churn.
Great. So next slide, this sets us up for the next piece of this discussion. The secret of change is to focus all of your energy, not on fighting the old, but on building the new. And so here we go. Basically, backing up a little bit, we touched on this. You can go next slide. We touched on our experience with at the time for both of us, and as I called out, over at Confluence, IT was about 50% remote. Being a rural healthcare system, we do have struggles hiring some of the higher skilled roles, because it is a limited population here, based especially in Wenatchee. Wenatchee and East Wenatchee is 50,000 people. So you can try to Scott's area, but it just depends if they're interested in moving to a smaller town. But we do hire out of state. So we had been working through that on how we support folks that are out of state that we won't be able to touch their equipment. And so we have found VDI worked very well for us. And we were basically right up when COVID hit, we were already had proven that it worked pretty well for us. So Scott.
Yeah, our experience, we were a little bit, I'd say, behind you on as far as having a lot of remote workers out of the state for sure. Really, we had a handful of coders that were remote workers, and we had enabled them through VDI, very similar environment. Again, there's a lot of similarities between the two organizations and the way that we've addressed all of this stuff. Our remote access, we had really locked down to leadership and individual contributors that were exempt, right? So we had to do some kind of quick changes there for hourly staff that had to move offsite and work remote and do some things like that. And then our IT staff, we were working remote no more than 2 days a week. So we were a pretty heavy on-prem type of IT shop, and that changed, with the blink of an eye. So.
All right. So to successfully work with other people, you have to trust each other. A big part of this is trusting people to get their work done wherever they are without supervision. That's a good quote, talking about here we are, the plan that we were trying to execute and the challenges. And what was funny to me is when Scott and I got together, for both of us to call out, and I don't want to say it's a barrier. You can go to the next slide, sorry. I don't want to call it a barrier, but definitely a challenge. We both had a challenge in the HR process side of this. In other words, the policies and the process is really not super clear. We were just getting going on that over at Confluence when this happened. In addition, we didn't really have a lot of support from managers who are managing remote teams. This is pretty new to the organization. So we didn't really have guidelines for saying, hey, here's how you measure productivity, et cetera. Now, really, it doesn't change from a day-to-day what you do physically in place too, but there's a perception there. And so we had to work with that with our managers and our leaders. One of the things I want to call out that we're doing that's a little different that we're piloting is as part of the local nonprofit tech alliance that I'm part of. We are actually piloting a certification program for remote workers, and it's through Utah State, and actually Washington State is also looking at it, and I'm actually attending it just to kind of audit the class and see if it's worthwhile, if it's and it's something we may want to offer to any, or require actually I should say, of any employees that we hire that are remote. Scott, you want to talk about HR and the second piece, and I'll go back?
Sure. Yeah, I actually thought that process, the thought of partnering with higher education to get some formal training for folks was brilliant. It's something I actually want to see how that goes. Robert, we've talked a lot about that. This is a new competency, right? most of the workforce that was in place at Overlake really had very limited competency in virtual meetings even. So Zoom, WebEx, fill in the blank. There were always struggles. Can you hear me? Can you hear me? Oh, why is my video on? All the stuff you see on Saturday Night Live, all those skits, that was happening in real time while we were trying to solve real problems. And I'm sure everybody on the conference today was experiencing the same thing. But all the comedy stuff aside, it's a new competency for leadership, right? So lots of conversations. IT was actually leading this thought leadership around how do you manage a remote workforce, because we had been managing a remote workforce for the longest. So we had conversations about, okay, well, how do you manage your team right now? Well, we manage by walking around. Okay, you can do the same thing virtually. And let's talk about how that would look. And so there was a lot of cultural change, I think, that we had to iron out with our HR partners, and building that into policies and KPIs and things like that, and discussions about how bad will this erode our culture? Will employee satisfaction plummet? Will productivity plummet? All those things that we were all probably thinking the same thing. And so we worked with HR, and that was just the beginning. The things, I'll move on to the support for the home users, which was quite an interesting experience. I hadn't really thought about supporting home users for many years, going way back to when I was a consultant, just getting my start in IT, doing house calls and things like that. So we opted not to limit the use of BYOD. We really wanted to deploy Overlake solutions. We did have some BYOD, but we opted as a policy to try not to use BYOD. We developed a remote worker kit, and that's everything from hardware to the policies that support that, to training and desktop, kind of aids and guides and things like that for how to use Teams or WebEx or, fill in the blank. And then we opted not to do house calls. So one reason for that was staffing. Obviously, it's really challenging to staff up a desktop or help desk team to do house calls for hundreds of people. But more importantly, we were really focused on the infection control aspect of that, of going into people's homes. One, having our team go into other people's homes, but would they actually want our team to come into their homes and set things up and support them? So we opted not to do IT house calls. I don't know, Robert, your experience were pretty similar.
Yeah, we were a little different. I think this is one of our biggest differences was we were encouraging OD. And the reason for that is just to get people up quicker. And our team, it was just slammed, and we knew we were going to be too slow to deploy for what some of the departments wanted to get off site pretty quick. But we were really clear about the fallback plan is not to escalate technology issues if you can't do your job. And we got buy-in from all of ELT basically saying, yeah, they agreed. It's like, go back into the physical office. We got enough people remote that it's safe enough to come back. The thing I feel kind of bad is we didn't really think too much about the infection control piece of sending people to people's homes. I should have thought more about that. But in reality, we were just kind of throttling the work because there was just too much. I'm the same. I feel the same. You just reminded me when we switched all the board meetings over to Teams and all of the mute issues. And I dreaded going to those because it was constant problems. And it was like you said, like the skits on Saturday Night Live, it was super frustrating. But once people learned it, and now people are definitely much better at understanding when they're running two mics, et cetera. So it's been a huge plus on that. And it's given people a lot of flexibility about where they can work and access to what they need. We just, bottom line, do not have the staff to make house calls. So we do, like I said, make it very clear the backup plan is to come in if you need to do something. And we also say there's no guarantee you can do 100% of your job remote. You may have to come in for certain things. All right, so next slide. So now talking about the future here. The future ain't what it used to be. That's short and sweet, but absolutely true. So next slide. So basically looking to the future, and this is where the effort is now. It's the longer term plans. Both of us, Scott and I are very similar on these as well. we're both looking at, and well, I don't want to speak for you, Scott, but basically looking at reducing the number of physical locations, especially if it's non-clinical space. So right now we have an effort to strategically consolidate our space and put like teams in the same physical locations where the schedules will allow shared space, shared offices, touchdown desks, whatever you want to call it, where if a team is in, they're in 2 days a week, another team or even half a team, coordinate it with others so that we basically have buildings that can have max capacity being used, but at the same time with half the people at least remote that are working on the same items. And so that's been really nice. The blend of remote work versus on site. We've really left it up to our leadership team. They have a lot of flexibility about how much they need people on site, depending on if they can get things done or not. And so we are absolutely working to support them on that. We do constantly have use cases that we need to review that require solutions that maybe we haven't met yet. But I'll tell you what, it is absolutely amazing how when you send a team home and they at first complain about something that doesn't work and you tell them you're not going to be able to support that at home, it's amazing how they change their workflow so they don't have to come in. And so that has been a huge plus for us. I don't know if you're seeing that, Scott.
Yeah, you bet, man. There's no doubt about that. Yeah, so I think we're doing the same thing as a lot of organizations are. We're relooking at real estate strategy and do we need these huge spaces? The answer is probably not. Being in downtown Bellevue, real estate is at a premium. It's very expensive. The areas that we have, IT, centralized scheduling, a lot of these departments that can operate anywhere or operate completely remote. We have them in some fairly expensive real estate in Bellevue. And so we're rethinking that, looking at reducing the size and footprint of those spaces. Absolutely. Kind of talking about what should the new workspace look like so that we can keep our culture in place. We have a really good culture kind of team environment at Overlake, and how do we keep that team feel while having 80% remote work? And we're looking at touchdown cubes and shared manager spaces and things like that. But I think that the details that will matter will be in the scheduling of groups of teams coming in together on site at whatever frequency to really get that time to bond and get work done, do strategy work, things like that, and just kind of coordinate that type of schedule for the limited space that we will have in the future. So.
And Scott, I did steal this one from you. It's on my side, but I think you actually gave me this idea, and that was looking at things. This is kind of down the weeds, but it's a good example of the possibilities with the remote work blend. Is like the expensive phones that we have sitting on desks that are never used, and pretty much you just get sales calls on them. Mine, I'm guilty of that. I only answer my cell phone. I don't even look at my desk phone. And so things like that, where we're looking at waste, saying, why do we have this when, especially with a remote workforce, let's lean on software phones and, or software-based phones and mobile phones versus the standard traditional type of systems. And that's just not just phones, but anything like that where it kind of changes up the mix. And that's why I'm looking forward to talking to the panel today, because I want to hear what our panel members are looking at in the future as well.
Yeah, you bet.
Yeah. Anything else, Scott? I think I'm good, but
no, I think I'm good. I'm really interested to hear our panel members as well.
Good.
Well, thank you, Robert and Scott. I think that was a great presentation. We're going to move to the panel section here, and I want to remind you that on your Zoom board there, you'll see a question and answers button. There's also a chat field. So if you want to start putting in questions there, you can do that. I'm going to ask our panelists to bring their cameras back up so we get everybody on here. But we have 3 additional IT leaders that are going to be on the call with us. We've got John Norenberg from PeaceHealth. He's the system VP. We have Maryam Gholami from Providence. She heads up digital innovations, group vice president there. And then also Dr. Zafar Chaudhry, senior vice president, CIO at Seattle Children's. So Brian, if maybe you can put the cameras back on and get people back on with us. I'm going to ask the panelists that are joining us that question. Actually, Robert was bringing up. What are you seeing in the future? What are your plans at each of your organizations? Just to give us an idea, and then we'll set a level set, and we'll start coming up with some questions from there. So this will be one of those.
John Norenberg from PeaceHealth here. You know, the immediate future isn't particularly showing itself to us at the moment. Our headquarters building here in Vancouver is all but shut down. We have some folks that are going in. It's reserved for kind of need to be face-to-face folks, which are very few. And then we have a number of our, we call all of our employees and associates here caregivers. So we have a number of our caregivers who live in places that don't have broadband internet. So those folks are also going in. But the building is emptied to the point where they're going to be reconfiguring it all the way, and they're going to be reconfiguring it to a much lower occupancy, not only for COVID, but just for the long term, is my understanding. So what I think that we've crossed a threshold here, whereby like many other industries that have a lot of remote workers, I think we've crossed that threshold. We haven't seen any performance downgrades. We haven't seen any productivity downgrades. In fact, the work on productivity is, I have to work harder to remind people to log out, turn off, right, than I ever have in my life. And by the way, I was a big doubter up until just recently when I started watching my grown daughters work remotely, and I realized that the younger generation had kind of figured it all out, and I was a little bit behind in my thinking. But yeah, you touched on a number of things, the technical things. It sounds like we're all in a different spot, but in short order, we're heading to the same goal. You know, frankly, we were a huge Skype shop, and during COVID, we flipped very heavily over, and we're now a huge Teams shop. We do have expensive phones on desks, but at a corporate and administrative level, we only use them for outside calls. And so I think that's a big change. And I also think that we're going to have to do something about the fact that we predominantly use VPN. Most of our applications are accessible via the web. So we're going to secure that down and drop our use of VPN down. So the future, we have quite a bit of work to do in the near-term future. In the longer term, I don't see us going back to the headquarters building en masse. Few of us will, but I don't see the workers going there. There just doesn't seem to be any economics behind it.
Thank you, John. Maryam, what would you add for what's going on at Providence for the future?
Just for context, I am not the CIO for Providence. So my colleague and good friend BJ Moore actually runs that organization. But I'll just talk about my experience, and then I'll tell you about a little bit about what my team is working on. So during the pandemic, our IT organizations, BJ, who actually was at Microsoft before that, they were actually really fast at sort of taking care of we had the productivity tools in place. We were already having two-factor auth, and a bunch of security updates had happened. But I think during the pandemic time, they were able to scale teams across the organization, Microsoft Teams, and bring a consistent platform for communication. My team, I run the team of 120 people that consists of software engineers, product folks who actually do incubation. They build products that gets later commercialized and sold to health systems, and then we spin them out as separate companies. So for my organization, we always used, and I'll tell you a secret, we were actually using Slack. My team specifically, they use the Slack for chatting. But with the pandemic, there was a need to now communicate with all these other folks across the organization. So having a platform, Microsoft Teams, that brought us all together was really helpful. This was on the caregiver side. My team's focus has been on how do we connect consumers or patients with providers. We were actually working on a platform that had virtual telehealth as one of the components of it. And we had a lot of focus on thinking about how do we route consumers to the right modality of care, and how do we actually manage capacity. So when pandemic hit, it was a matter of taking that platform and scaling it. I will tell you that it was really busy. So March and April, I think I was on 4 hours of sleep a day, and the rest of it was a bit of exercise and really just working on scaling the virtual platform that we had put together for connecting consumers and providers. Additionally, on that front, what we did, one of the things that we were focusing on, I told you about this routing. So we already had a tool, a chat bot to begin with, that would ask patients questions about their symptoms and navigate them to the right modality of care and help them book an appointment. So during, this is end of February, I got a call on a weekend that, cancel your trip for HIMSS, because we don't think you should not go to HIMSS. We are looking at the numbers; it's not looking good. So the whole executive team, this is across all the lines. We got on a call and started brainstorming what we need to do. And BJ, his team, our CIO, my team, everybody was basically there and sort of dividing and conquering. And in that context, my number one task became build a tool assessment bot tool that can actually help the patients, help with their anxiety, and then navigate them to virtual. And because we had to bring providers online, and that was going to take time to bring everybody online. Now, all those providers who didn't want to come online, have a scheduling online, do virtual visits, now they were knocking on our door. But we had to kind of figure out how do we manage the demand that we were getting from patients, how do we manage the capacity. So interestingly enough, September last year, I had started talking to Microsoft because I thought, you know what, I'm not going to build an NLP platform from scratch, and I need to find one of these big guys, whether it's Microsoft or Amazon, to use as the underlying platform, and then build on top of that the knowledge model, everything that we need. So with the pandemic hitting, then I pinged them. They have a team in Israel. We got it started on actually working on the assessment bot, and my team specifically, the entire organization is on Azure, but my team, they had started their journey 5-6 years ago. So we were on AWS. So this was in a matter of week, get Azure set up for my organization, and build on top of that health bot, and get my team to actually learn about Azure as well. So that went, I think that went pretty well, because we were able to make that available to other health systems. And with our virtual platform, we actually, that we had built, we had to bring another health system who wanted to start with retail, but with pandemic, they're like, guess what, Maryam, we got to go live with virtual. So we were actually able to help other health systems as well in that construct. I'll add something that I didn't hear here, and we talked about future that I have concerns about, and maybe it's not the CIO's job, and it's the job of us all together, but it's around mental health. And it's something even for my team. We were working, and we're in this response period, the burnout, and then overall mentally dealing with everything else that's going around us was an issue. So something that we did really quickly, my team was looking at mental health for consumers. We actually have a strategy team that focuses on that area quite a bit. And during the pandemic, this we brought up very quickly. We brought up Silver Cloud, but we also provided behavioral health therapy virtual to everyone in the organization. We put the site together. This is the marketing team who reports to my boss as well. We put a site together quickly, resources for the caregivers, and this is for them dealing with personal issues, because I think something that's happening now, you can see my living room, our personal life and our work life has merged, and we just need to think about how do we integrate it well, and how do we make sure that we are going to be resilient during that period. So I think future is about thinking about a hybrid model, but really how do we manage the folks mentally. And I'll tell you that everything that Scott and team are doing on the IT side is immensely important, because the worst thing you want to have is network issues and not getting to the things you want. And that's just everything, all the stress is just going to add up together. So I am personally very grateful for the work that you folks are doing so that teams like us can work on the next generation of applications.
Thank you, Maryam. I appreciate that. There's a lot of great information there I want to come back to. But Zafar, can you tell us what Seattle Children's sees in the future and what you are looking at?
Yeah, so certainly at Seattle Children's, we've had a similar journey to what's been described here today. We went from very few people working from home to currently just over 4,000 people working from home. And we're geographically dispersed, so we're across 4 states, makes it more difficult. We've seen similar trends, yes, people working from home. We provide that through VPN, VDI, bring your own device. We've seen issues in people's homes regarding their own internet connections, regarding their Wi-Fi routers as being problematic. And of course, it's always our fault in IT when somebody can't connect to something. And so I found myself being tech support for some very senior leadership to say, maybe you want to turn it on and off again, and things like that have happened. But what we decided very early in this journey was this was an opportunity for us to completely change our real estate model. And, you know, our IT folks are in great offices in downtown Seattle in some of the most expensive real estate you'll ever lay your hands on. And so we spun up an internal group about 8 weeks ago that said we were going to have a permanent work from home solution, and we were going to action that. So that actually went live on the 1st of November. So 2,000 people are going to work permanently from home, even post-COVID. They have been introduced to an online marketplace. They can select their equipment, they can select their furniture, they can have it delivered, they can pick it up through a drive-through service. And then once they are working from home, they are able to access 24/7 tech support. We don't do home visits, unless it's me. I might go to somebody's house, but we won't do home visits. They'll get support remotely. We take access of their machines remotely. So that's just kicked off. But at present, you know, we're keeping that 4,000 level. Post-COVID, it'll probably drop down to about 2,500 people working from home. We've done a 10-year model for our real estate strategy. And what we're learning is that if we keep this model up, that, you know, we're going to save almost 100 million in 10 years on real estate costs from a rental perspective, money we can reinvest in pediatric care. So that's what we've seen. And I certainly support Maryam when she says, one of the biggest things I've also seen is burnout, mental health issues with the team, nervous breakdowns. The organization has provided employee assistance. It's available. Counseling is available to every staff member in our organization. I'm not sure people are really utilizing that. I think it's probably the responsibility of us as leaders in tech, certainly for my tech group, that we reach out and we encourage conversation amongst ourselves. We encourage each other to lean on each other. I think maybe in the community there could be more collaboration. But this is going to continue, right? I mean, fundamentally, this problem isn't solved. And people are burning out. I suppose it's really difficult to do your job, do homeschooling for 4 kids, and then realize your Wi-Fi doesn't work very well. It's all very, very stressful. So we've seen that trend, but we've absolutely just decided it's time to go into a permanent model of working from home, and that has been actioned. So we'll start getting feedback. We're only 5 days into this, so we'll start getting feedback of whether that technical support is helpful, whether the delivery of equipment is timely. We'll also be providing technical support. So if your equipment fails, you will receive a new kit. You will send us back the old kit. So we're sort of using some of the logistics you can get from FedEx, UPS to help us in that model. So that's what we're doing at Children's.
Thanks. Thank you, Zafar. That's interesting. It kind of ties into a question I've had. We've just kind of been bouncing around the background here. We talked about culture, taking care of your people. So I'd be curious to hear from everybody. How do you feel your teams are doing right now? And then what are you looking at as far as keeping that culture up? Because one of the perks, I've been into a lot of your offices downtown, Zafar, and some of the ones you've got over there, Scott and Overlake. That is a perk. Part of the perk is, these great offices, these great spaces, and working with really smart people, side by side, sharing coffee, sharing drinks, all that type of stuff. And now you're back in your living room. How are you managing that whole transition? How do you think your teams are doing, and what do you think you're going to have to change and do differently?
Yeah. So I'll just speak for Overlake. That's a challenge, right? Right now my IT teams work in a building that's, glass windows from floor to ceiling, beautiful view. And yeah, you're right. A lot of really smart, but also really interesting and good people that they work with and they get to see every day and talk to. And so that's a challenge. I'm very impressed with my management team. They've engaged their teams in many different ways. We also deployed Teams, Microsoft Teams, rapidly, and they've been taking advantage of, having, virtual happy hours, doing, virtual game hours and things like that with their teams, and trying to just kind of build that culture, continue to build the culture in a more virtualized setting. But it's a challenge, right? A lot of the perks of recruiting people and kind of trying to pull them away from some of our biggest competitors, like the Microsofts of the world, are that we give this really nice work environment and you have a nice place to sit down and call home. So that's still a work in progress. I don't know, Zafar, what you're experiencing.
I think it's not going to be easy. I think people, interesting enough, technologists are massive introverts, right? Including me. But I've come to learn of working from home for such a long period of time now that I actually need human interaction. And it's great to spend 9 hours a day on a Zoom call, staring at people and feeling all blasé, but I don't think that's really doing it. So we're similar to you. We've tried to do some virtual events and team bonding and everything else. And, to top it off for us, we did a go live on Epic from Cerner smack in the middle of this. And, we're the first in the world to do 100% virtual training on Epic. And it's not been easy. There's been a lot of stress and strain, and operationally, there's been difficulties. So I think what we're going to end up having to do is to build a regular cadence model that says you will come into, because we're changing our existing real estate to hoteling space, that you will meet with your teams on a regular basis physically, once we're allowed to do that at least maybe once a month, so that you do have some of that face time whilst balancing that remote working. The other initiative we've added to all of this is we've expanded our hiring processes to say that we will now hire, we've authorized about 7 different states where we can now hire people. So the future for technology is going to be, I could probably have a team in Florida and a team here in Seattle, and that's really going to change the way in which we work. We can learn some lessons from our technology partners, right? Companies like Microsoft and Amazon and others and Gartners and everybody else who've been doing this for a really long time at a sort of global level. There'll be some learnings. but there are some tools. We're currently talking to Microsoft. We use Teams as well, and they have some wellness tools built into Teams that we're currently talking to them about to maybe improve that. But certainly feedback from my team has been, it's still better to have some physical interaction. And on a positive note, there are those team members that live very far away who have gained time from being able to not travel into the office on a daily basis. And that has helped. It's reduced costs for certain individuals. I think the data sort of shows that for the average person, you're saving about $7,000 or $8,000 a year by not paying for parking and traveling into work and those things. And that helps, and it's great in Washington because we don't have any income tax, right? So there is some benefits there for staff members.
Yeah, I agree with that. I think the cultural issues are at the very, very beginning of showing themselves what they may be, because in my opinion, our culture survived COVID, and we had a nice, strong culture on our IT team, and we were, really friends. And when you go into something like this as friends, it's actually easy to keep it up. But now that we are beginning to hire, and about the middle of summer we started hiring again, and as we hire and we bring people in who have never ever worked in the same building with each other, the culture is going to get stressed out pretty hard. I think coming forward, and so having the tools, and I'm an engineer. I'm not a psychologist, so I don't really know where to even start thinking about this, but it is something that I'm worried about, because it's just going to be hard to hold on to that as we bring new people in and they begin to impact us in their own unique ways, et cetera. So I wish I had the answer, but I don't.
I think over at Confluence, it was everybody, we were trying to deal with employee satisfaction. So we were leaning toward, we were allowing half-time remote work. So it's kind of like watch what you wish for, because then all of a sudden now it's 100%. And I do think right now it's pretty positive. We don't have too much negative feedback on it, but people are wanting to get together. I agree with what Zafar is doing as well, that we're probably in the future state going to require at least like one time a month getting the team together where it's possible. If they're out of state, we have to look at those exceptions, but that's not those truly. It is much more than people planned on as far as being 100% remote. I think what's helped us a lot is we are a heavy Teams shop as well. So that's been deployed I think, we got through all the initial problems, but now it's running really great. So it does feel like people can quickly connect when they need to, and it's pretty easy to get a hold of somebody and feel like there's a little bit of a connection there with actual video. But you're right, after so many hours of doing video, it's like you're kind of like a zombie by the end. So I'm lucky because I go in, and we do have an IT building we have about 150 people in the different area of IT and many departments that support that share this building. And so it's nice because at any given time we allow something like 20 in there. And so if people are really feeling like they're disconnected, they can come in. So we do have that option right now. But I am learning a lot from the panel here. I like what you're talking about, that permanent model and some kind of like marketplace for how to deploy equipment. I'm going to steal that, I think, a bit.
Yeah.
Thank you.
Zafar, I'd love to talk to you about that, because it's been a dream of mine since I showed up here at PeaceHealth, is to create the online marketplace for end user systems. So I'd love to know how you're doing that, maybe an offline conversation.
Yeah, absolutely.
I've coined the term blue light radiation poisoning, because I certainly feel at the end of every day like I'm at risk for that.
Yeah, I hear you, John. I feel the same way.
Yeah. Well, I would like to bring up, Zafar, if there is I don't know if you want to do a commercial, but there has been a couple of questions online too about the hardware perspective, what you're using for that. Is that something that you created yourself, or something that you
So
white label?
what we did is we got a cross-sectional group of stakeholders to develop personas of individuals who would work from home. And what came out of that was 4 different personas of types of user. So user type 1 would be the one that works from home 100%. And their technology kit would include a laptop, a keyboard, a mouse, an additional screen. And we then did that for the other 3 personas. So when you go on our marketplace, it's literally just a website. You've logged in, you select, first of all, the wizard asks you, tell us how you work at home, and then people describe it. I'm in the office 1 day a week, or I'm not, etc. And then it recommends a kit to you. You then say, I'll take that kit, and then then they'll ask you how you want that kit to be delivered. So it'll either be shipped to your house, or we have a drive-through. We built a drive-through facility where you can drive your car in, and the technician will put the kit in your boot trunk, and off you go. And so it's a combination. So there's the laptop-based kit, there is the VDI unit-based kit. So it depends on what your use case is at home. I anticipate, I have about 500 IT people, and I anticipate that 80% of them will be 100% work from home. I still have my clinical engineers, etc., who need to be on site. Obviously, desktop technicians need to be on site. So that's how we've found the balance. And then that's been expanded to HR, facilities, a whole bunch of different departments are participating, hence why we got to the agreed 2,000 figure.
So this is there's a lot of questions about this, but are you doing, additional question is are you doing office furniture, desk chairs, kind of the Google model of giving people money to buy those types of things?
Yes,
okay.
So part of the marketplace, once you've selected the equipment you need, it moves on to, well, what furniture do you need? And what we've agreed to do is give every work from home, who's going to be permanent work from home, a $500 stipend. And they then can select furniture against that $500 stipend. And what we've negotiated with our furniture suppliers is a reduced rate for the commercial type furniture, because people are interested in desks, these desks that go up and down, the fancy chairs. So there's enough on the marketplace for you to get some reasonable equipment. What we've decided not to do is pay for internet connections at people's homes. And we've decided that we're not going to pay for fit outs of your office space, or it's for you to find an adequate office space. We provide a remote service as well, where our ergonomics people can dial into a call with you. You can show them your space, and they can give you some advice as whether that space is actually suitable. What I don't want to see with my team is people in closets trying to do the work. And I think I did see one individual doing work from a ironing table, which was absolutely, you've got to stop doing that. That's going to be very bad for your health. But some people, it gets to that point where some people are living in very small quarters, right? If you're living in a 2-bedroom apartment and you've got your family in there, you may not have an office space. So we're still keeping that hoteling space open. People can go into the office.
Thank you. So there's a couple technical questions I just want to pop into real quickly. This has been a great topic. I do want to mention we're going to have another remote workers session next week at this time. And I'm going to ask some of our panelists here if you'd like to join us on that. I know John is, but Ellen's going to be doing a future conversation, and we've kind of gravitated that way already. So I ask you all to pop into that one so we can keep the questions going. There are a couple of questions just on technology. One was there's been mention of mobile phones, and maybe you can just give quick answers. Are your organizations supplying those for remote workers, or do they use their own? And then the follow-up question, we can answer at the same time, is if they have Outlook on their personal device, how do you manage security? So this is all around the mobile phone. If everybody go around and get a quick answer on that, that'd be great.
So this is Rob. Go ahead. Sorry.
We don't provide cell phones. That's the responsibility of the employee. And to secure devices, we use Intune from Microsoft.
Okay, thank you.
We are similar, other than we reimburse at a small rate of like $40 a month.
Okay.
Yeah, we do the same thing. We reimburse a $40, $50 a month stipend, and then we require that they have an MDM installed. Currently AirWatch, but we're looking at Intune.
Okay. Maryam, what do you? Oh, you're mute.
Sorry, yeah, I can talk about the, so this is more as somebody who works in the organization. We get some amount of dollar, I forgot, $25, something like that for internet. And then discussion has come about equipment and whether, reimbursement happens for that. I don't believe we have a policy yet for that. I really like what Zafar mentioned, because I have folks who really don't have the space or the equipment. So what I did is, for my organization, I said they can go ahead, grab their equipment, but they need to get permission. And since my team has been in Bank of America building in downtown, and there's security, everything, there are cameras, people have to follow that. But that's what we have done in terms of equipment. For the folks. I got inspired by whoever said that they're giving $500. Oh, it was Zafar who mentioned that they have figured out a program, because my team was asking for it. And since we are competing with Google, Amazon, Microsoft, those folks, I do want to come up with a system for that. So.
Thank you. John, what are you guys doing with the phones?
We're in a transitional state regarding cell phones. Is part of a number of different initiatives. We decided to stop the reimbursement program, but we still have a fairly large fleet, especially in the clinical areas. We also have a kind of an immature cell phone management policy. We'll be working over this next year, standing up a completely separate team to attack this down, with one of the goals being creating an MDM lightweight container for BYOD devices. Anymore, the Pacific Northwest is running a little bit behind the rest of the country, and especially the Midwest. Where I came from, people started demanding to use their own cell phones as opposed to demanding the company buy them a cell phone about 10 years ago. And to that end, that's where everything goes, because nobody really wants to carry two cell phones. And so you have to manage to a single device that you don't have where you don't own the asset. And that's where we're going to go with this. We're just not there yet.
Hey, I want to thank all of our panelists, presenters. This is just the start of a very robust conversation I think we're going to be having. We're going to continue it next week, but it's going to be one that's going to continue going on. Something I'm going to post for those who want to come on the next week's conversation. I'd like to hear what your thoughts are on the whole potential of the inequity this causes with people working from home. I never thought about that, but just some of the conversation we've had already is, if you've got workers that are, say, having to work in a very confined space or an odd space, it does make it a lot more difficult to compete with those that may have the space and the resources, to have that quiet space to do their work. So we're going to wrap up here, and we're going to continue this next week. I want to, again, thank all our people that come on the call to hear what we're talking about and be a part of HIMSS. We're starting next week off on Tuesday with Dr. Jeff Clark from Confluence Health, and he's going to be speaking on physician builders, which is a term from Epic, but there's a lot of other that's been kind of taken over by other organizations as well. And he is a panel that's going to follow up on that topic. So I look forward to talking to all of you next week on Tuesday. Thank you, and have a great rest of your week.
Thank you.
Thank you.
Thank you.